the name of Allah, I am Tawseef Iqbal. Today we have to discuss about advantages as well as disadvantages of intravenous routes. So intravenous route has a lot of importance as far as injection or insertion of medication into the body is concerned. So injection might be applied to the cubital vein or basilic vein or cephalic vein. So these are the famous vein in which we have to most of the time we are injected drug to reach to the systemic circulation. So cubital, basilic and cephalic veins are most important as far as intravenous route is concerned. Even we can inject drug to any vein of the body, but these are the important one. Now we have to look to the advantages of intravenous route. So the first advantage of intravenous route is no first pass metabolism. So we have discussed previously in enteral route and specifically oral route, because in oral route there is first pass metabolism. So this is the advantage of intravenous route, that there is no such first pass metabolism. Next is, as compared to other routes, so intravenous has 100% bioavailability. Bioavailability means the fraction of unchanged drug that reaches to the systemic circulation. So intravenous route has 100% bioavailability. Next point is drug avoid harsh gastrointestinal environment. If we have to take drug or solution tablet capsule by oral route, so they have to go to stomach, then to intestine, where they face a lot of different environment, acidic and basic environment, different type of digestive enzyme, metabolic enzyme, catalytic enzyme, where there is, we can say there is somewhat deficiency in those, or there is destruction of those. But if you take drug by intravenous route, so drug is evit or drug is safe from harsh environment of stomach and intestine. Next one is best in emergency situation, because as we look to other routes, they show their action in body, but they have little bioavailability as compared to intravenous route. But they are too much helpful in emergency situation. If a person has RTA or they have bullet attack or some other condition, so you can deliver drug, bulk form of drug, large quantity of drug in emergency situation to save the life of a patient or person. So this route is best in emergency situation. Next one is desired blood concentration is achieved, because bioavailability is 100%. So that's why desired plasma blood concentration is achieved. Next is this route is helpful in unconscious patient. If a person is in unconscious condition, or a person is in sleepy condition, or a person is in coma condition, you can deliver drug anytime to the body. That is not possible through oral or other route as compared to intravenous. Next is immediate action take place. If you inject drug by intravenous route, so they will immediately, they will abruptly, they will rapidly show their action. Next is quick onset of action within fraction of second, or you can say 30 to 1 minute, 30 seconds to 1 minute. In that duration, IV route medication starting their action, or we can say rapidly starting their action, which is not possible as in case of sublingual or inhalational. Inhalation is somewhat similar to intravenous, but as compared to transdermal, topical and enteral route. Next is absorption is not required, because there is no absorption in intravenous route, but there is absorption in other routes. Next is
blood, plasma or fluid might be injected. Bulk form of medication can be given. It either may be in IV bolus or IV bolus can also be given, but IV fluid or blood, plasma and other solution can be given to the body in diluted form. Next is avoid vomiting and diarrhea. If we take drug by oral route or sublingual route, so there is possibility and chance that patient can vomit, so or they create problem in intestine and person have diarrhea as happen with antibiotics. But if we inject drug to the body, so the patient will not vomit or they will have diarrhea if we give drug by intravenous route. Next is disadvantages of intravenous route. So this route is the most expensive, because expensive in a sense you have to need of disposable syringe, you have to need of other tubes like materials, so that's why this route is so expensive as compared to internal route. Next is irritation and cellulitis. If we inject drug at any site of the body, so there is possibility that the injection site become irritated and there is cellulitis. So what do you mean by cellulitis? Cellulitis is actually inflammation of body tissues, especially that below the skin, characterized by pain, swelling. So this is actually cellulitis. Next is technical assistance is required. There is need of paramedical or nurse or technician, because you cannot inject easily drug to the body through the help of injection. So that's why technical assistant, technical person, technical professional person or medical professional person is required, which is not necessary in case of other route is like enteral route. Next is danger of infection. If you are injecting plasma or blood to other person by intravenous route, if suppose a person have hepatitis or AIDS, so if you might inject drug by this route, so there is possibility, there is a risk that the host person become infected. Or we can say, if we inject drug to the body and if there is infection or contamination in vial or impure or at needle or disposable syringe, or we injecting drug to the body, so there is possibility if there is infection or germs, so there will chance to the host patient. Next is injected drug cannot be recalled back. So this is the most dangerous in a sense, because if mistakenly poisonous drug is injected into the body, so you cannot separate, you cannot isolate the injected drug from the blood, and possible in oral route, because if a person take poison by oral route and to that point which is not absorbed, so you can deactivate or you can give on charcoal and they will recall back, or you can do stomach wash or gastric lavage. But in IV form you cannot call back drug. And last one, painful at the site of injection. If you are injecting syringe or you can injecting drug by this route, so there is pain at the site of injection. So it's all about intravenous route. I have taken this topic from internet and Lippincott pharmacology book. Thanks for attention. Thank you.